Hello, I'm Sonja Petek, a survey project manager at the Public Policy Institute of California. Today I'd like to highlight some of the key findings from our most recent statewide survey on Californians and healthy communities. This survey was conducted with funding from the California Endowment and took place from January 18th to February 1st. It included interviews with about 2,500 California adults. Interviews were conducted by phone, both landline and cell phone, and were completed in 5 languages. This is our first statewide survey on the topic of healthy communities. It closely examines public opinion about the conditions in communities that can contribute to the overall health status of residents in those communities. In the wake of national health care reform, and as the state grapples with a $25 billion budget deficit and is set to make significant spending cuts in health and human services, one possible cost savings approach is to focus more on prevention rather than treatment. This survey examines Californians' attitudes toward issues that are not historically associated with healthcare policy, but which nonetheless can have an impact on the overall health of people living in communities. And it takes a look at Californians' attitudes toward a more preventative approach. I'd like to highlight 6 key findings from the survey. First, about half of Californians support the changes to the national healthcare system that were enacted by Congress and the Obama administration. Californians are slightly more likely than adults nationwide to express support. At the state level, just over half of Californians say they are very concerned that the state's budget situation will result in significant spending cuts to health and human services, and 6 in 10 believe that the state's healthcare system is in need of major changes. We also wanted to find out how Californians view their own situations. A second key finding is that most Californians generally rate their own health as very good or excellent and say that they are pretty happy or very happy with things in their lives. But lower income residents and residents with less education are less likely than others to express these positive views. And the same is true when they are asked to give their level of satisfaction with things in their lives, such as their jobs, their current financial situation, their health, the quality of health care that they receive, their housing situation, and the quality of life in their local communities. A third key finding is that when asked to consider services in their local communities, most Californians give good or excellent ratings to things such as their local grocery stores, parks and playgrounds, police protection, healthcare services, local public schools, and roads and sidewalks. Although on those last 2 issues, public schools and roads and sidewalks, the ratings are somewhat lower. We also see some key differences across the state's demographic groups. For example, African Americans are the most likely racial and ethnic group to give negative ratings to their local public schools. And across income categories, lower income residents are the most likely to say that healthcare services are not so good or poor. We also ask residents to assess some of the potential problems in their communities and find that African Americans and Latinos are, by far, more likely than Asians and whites to say that violence and street crime are a big problem in their local communities. On other potential problems, Californians place unemployment at the top of the list. They are less likely to consider other issues a big problem in their local communities, things such as air pollution, a lack of places to safely walk and exercise, or a lack of restaurants and grocery stores that offer healthy food choices. A fourth important finding from the survey is that most Californians are generally aware that conditions in communities can greatly contribute to the overall health of people living in those communities. Things such as good jobs, good schools, good air quality, public safety, access to fresh foods, and having places to walk and exercise. Nearly half of Californians say that the conditions in their own communities are having a very positive or somewhat positive effect on their own health. And interestingly, 34% of Californians say that the conditions in their communities don't affect their health at all. The fifth key finding is that an overwhelming majority of Californians, 75%, believe that obesity is a very serious public health problem, but there is a partisan divide on whose responsibility it is to deal with it. While most Republicans feel that this is an individual responsibility, most Democrats feel that both individuals and government should be addressing it. Finally, most Californians, 6 in 10, believe that healthcare services in their local communities should give more emphasis to prevention rather than to treatment, and just over half of Californians believe that healthcare policies that include a preventative approach are very important to the health of people in their communities, and an even greater percentage believe that universal health care coverage for children is very important in preventing illness. I'd like to thank you for listening today, and if you're interested in the full report, please visit our website at www.ppic.org.